Thank you for having me. Like Robert mentioned, my name is Eric Batista from the City Manager's Office. We're going to talk about two kind of initiatives, two things that are happening in the city. But first, I just want to thank all of you for your contributions, for your support to the city and to the work that we're doing. Extremely also thankful for the work that you guys have done with the Elm Park Bridge. How many of you have been able to see the construction finally is happening? So, right now there's work happening there. There's contractors are there. You see a lot of students there. They're from 7:30 in the morning to about 1 p.m. During the day. So they're there all day performing and constructing the bridge and building it right on site. Right now the tentative date that we have, which this date came from the Robert Kraft family themselves, which is the father and the sons are going to come for this event, is November 13th. That's a tentative date. Is November 13th. We're right now we're doing everything we can to make sure that that day is the ribbon cutting. If not, we will make sure we let Robert know of any changes. Again, we're all flying under their schedule because that man is an extremely busy man. But I just wanted to give you an update to where we were with the bridge, because you guys contributed so much and supported so much on that bridge. So thank you for that. So next thing is, one of the things that we're looking to do is, one is in regards to youth violence. The city kind of work with a lot of organizations, community-based organizations and partners and institutions in the city to put together a violence plan of how to reduce and identify many strategies, either best practices or national models, in a way that we can reduce youth violence in the city. So we partner with all these organizations. We developed a plan or a chart of all these strategies, but right now we're under the action plan process. We're working strategically to try to put this all into an actual implementation plan. There's some things that are actually are working and developing right now as we speak, and there's some things that already started to happen. But I'm going to talk a little more about that, but I'm going to pass it over to Cassandra, who she's going to talk a little bit more about the opioid abuse issues that we have here in our city, and what are some of the efforts that we're trying to target and trying to do to improve that area, which also is tied into the youth violence initiative. So,
thank you. Thanks for having us here today so we can tell you more about the work that we're doing.
Use the mic. Use the mic.
Oh,
There you go. You're gonna put it up.
closer, all right. Sorry. The opioid epidemic has hit Worcester hard, like it has the entire state and the nation. And the city manager has tasked our health department with looking at an all-of-the-above approach. We had started looking at this and putting strategies in place back in 2008 when we started to see numbers rise around this issue. But at this time, they are unfortunately still increasing. And there's a lot of people who are really passionate about this, including our new Commissioner of Health and Human Services, Dr. Maddie Castillo. And we've been working very closely with her since she started to improve the continuum of care and access to services for people with substance use disorders. What we do to try and address these issues is to convene folks from across the community, from all different pieces to solving this problem. We have people involved in prevention, intervention, treatment, and recovery working with us as closely as possible to find the solutions to this problem. A lot of the prevention work that we do with young people ties directly into the youth violence prevention work that the city manager's office has taken on. And we've built wonderful relationships with the Youth Connect program. I'm guessing that many of you have heard of Youth Connect and what it's done to serve youth around the city during the summer. This past summer, we spent a lot of time in the program providing prevention programming to the youth to try and keep them from ever beginning to abuse and become addicted to substances. We are, with this all of the above approach, combining known evidence-based strategies, current best practices, and exploring innovative local solutions. We received some funds from the Mass Department of Public Health to support these prevention initiatives that we have working with youth and with providers of healthcare services in the area. But these funds that we're currently receiving are not enough to address the full impact of the opioid epidemic on this community at this time. We need local solutions to the problem and local resources to deal with the epidemic. Some of the things that we've done on the local level already is put together a task force, which is going out interdepartmentally on a daily basis to assess and find people who are on the street and are in need of immediate services for substance use and find them places to go so that they can receive the treatment that they need. Another thing that we've worked on is increasing the access to Narcan for the people who are overdosing in the city. We have trained all police and all fire in the city of Worcester to carry. So now all of our first responders are carrying Narcan and able to save people who are overdosing on opioids. What we would like to do is expand the number of people who have access to that to additional employees, people who are on the ground and are most likely to encounter people who have overdosed in the city. It's unfortunate, but there's a lot of people who are overdosing in public buildings, and there are certain people who are most likely to encounter them. And we know that the sooner that that person can be breathing again, the more likely that they will have a chance to successfully enter treatment and recovery. So we really want to save lives, and that is a big component of our work right now. I think that we have a short amount of time, so I don't want to get into too many details of what we're working on. We have a lot of different things in the budget, as along with the immediate saving of lives, there's some pieces on how we'll be raising education and awareness. We work with a lot of community partners, from the healthcare to the Boys and Girls Club, to parent learn to cope groups and things like that. So we're going to be working with all of them to do additional awareness and education around this issue. Thanks.
So in regards to some of the work for the recreation component, one of the things the city was heavily involved in for many years was a recreation program called Wheels to Water. This program evolved to be called the Recreation Worcester, which is now involved in the parks in the city. It's trying to take back the parks and provide programming and activities in the parks itself for the youth and the kids in the city. This year we had 11 parks. We had about 1,600 to 1,700 students registered, and over 10,000 visits within those 1,600 individuals who registered. Their ages were 7 to 13, but we also had some younger kids and even older siblings who joined as well. The program was tremendously successful. Like I said, it was 11 parks. We had many multiple organizations who partnered to come in to provide some of their services and some of their programming. For example, we had like National Grid come in and take part of some of the work that they do. One of the times that they do a solar s'mores activity with the kids. So they do really innovative stuff. We had the fire department come in with their trucks and talk about safety and bike safety and things like that. So one of the things that the manager has done, he's spoken to the superintendent to try to get the schools opened up again after hours. So there's a lot of investment in a lot of some of the schools here in the city, where we're spending $50, $60 million, but at 3 o'clock in the afternoon, they're closed and they're not accessed. So we wanted to tap into that resource. So one of the things that we've been able to propose to the superintendent is to open up 8 schools, 2 schools per district, after hours, 2 days per week, and also on Saturdays, where it allows now an opportunity for community partners, where we're partnering with Youth Connect organizations and others to come in and provide some programming, have some recreational activities, have some arts, some tutoring component to it as well. We've connected with the colleges as well, and some of the colleges have committed to having some of the youth come in and provide some of these tutoring and activities to the kids. And we're doing it for the ages of 7 to 13. They come in for the first 2 hours, and then the last 2 hours will be the individuals who are in the high school from 9th to 12th grade. So we're covering now, not just from 7 to 13, we're covering a huge number of kids in the city. And again, the reason is the way it is to get kids involved is to, the more you keep them busy, the more they stay away from doing things that they're not supposed to be doing. So that what we're trying to do is really occupy them, giving opportunities for them to be able to go into the schools. I don't know if some of you know, but I was too young. I probably wasn't even alive by the time. But the manager really speaks about when South High used to be open, and he used to pay $1 or $2 and go into South High and play sports and go swimming and do a lot of fun activities. So that's what he's trying to implement. He's trying to bring that back into the schools, open up the schools after hours. One of the great things is the superintendent is extremely supportive. The one that's leaving and the new one that's coming in, they both have been extremely supportive of this program. It's developing as we speak. So we're looking to really partner with you guys and see how not only can you support the program, but also get involved and volunteer and provide any expertise or any ideas that you may have that we can implement and put together into the programs in after school. And like I said, it's 2 per district that we're looking at. So what we're looking at is that each kid will have a school that will be nearest to their neighborhood, or within a half-a-mile radius of the neighborhood. Again, it's a lot of activities. There's a lot of stuff that we're hoping to do. We're looking to launch right now in January with this program. So we welcome, the support and any feedback from you guys as well. So thank you for having us. Thank you for giving us the opportunity to speak to you and share with you. And then I look forward to seeing each and every one of you at the ribbon cutting for the Elm Park Bridge, because it's going to be a good time and a good celebration, not only for the city, but also for you as Rotarians for your involvement in the bridge. So thank you.
Does anyone have any questions? Now is the time to ask questions. Okay.
Hey, Bob. Bob. I have a question. I'm sorry, I didn't see you.
Okay, well,
I have
give
a
it to
comment.
the microphone. So everyone's going to wrap it up.
I have a comment for Cassandra. Has the city manager's office or you contact the Salvation Army regarding your OPA program? We have on Cambridge Street the ARC, the Adult Rehabilitation Court, with 115 beds. That means there are 115 people that are in recuperation and rehabilitation on Cambridge Street. And I don't know whether you have contacted the co-directors of that ARC.
So we have been in contact with them and have recently gone down again to talk with them at the site about how we can work together better to address this issue. There's a lot of different places in the city that are serving people directly who need beds, and so we are working with them.
Okay, so Captain O'Gallagher should be on their task force, and I don't think they are.
You are correct. We will ask them to join the task force.
Patrick and Sana O'Gallagher.
Okay, thank you.
Okay, Dave has a question. Part of my weight loss program to walk down here. So, it's not working though.
Thank you. I have a question for Cassandra. As you know, the club's very interested in this project, but we've been kicking around the idea of education, and in an effort to be brief, you didn't spend much time on education. Could you talk to us about where you might be going with education, who the targets of education are, and what your message is?
Back to the front.
You should jog instead of walk.
Yeah.
My Fitbit's working.
So we have really 3 targets of our education with different messages for each target group. So one of our education pieces is working with youth and educating them about the risks of misusing opioids and that these are potentially addictive substances. And so we do prevention education with youth. We also target parents and grandparents where we believe that they would have an influence over the environment in the home in which young people are living, as well as they are the strongest connection to their children's future. So we have messaging which comes from the State Department of Public Health and was very well developed. We worked with them on, over the past couple of years, doing some focus groups and things with parents to make sure that the messaging resonated with them. And it provides information on how you can keep your kids safe as well as talk to them about the issue. And then there's also education and awareness that we're doing with prescribers of opioids. So there are physicians and dentists and some RNs who would be the people who would directly prescribe you the opioids, and there's pharmacists where you would get those from. And so we've been trying to do directed education with them on how to safely prescribe and to educate their patients around proper disposal and being aware of the potential for abuse of these medications.
Thank you.
Thanks.
Is the substance abuse problem worse than it has been historically, or is it just getting more attention? And if it is worse, what's the cause of it?
That's a very difficult question to answer. The cause of it, there's multiple causes that come together to increase the substance use, particularly around opioids. One piece of that is the access. So do people have a very high supply and access to opioids in their local community? Another piece of that is there awareness that opioids are addictive and how addictive they are? And then the other piece of that would be additional things that are happening in the community that may lead to people being more likely to abuse any substance. So then there was another piece of that question.
Is it really a worse problem than it had been, or is it just sort of the issue today?
Right now, overdoses from opioids, they are a worse problem than they ever have been. We're seeing rates of overdoses. No one's seen rates like this, numbers like this before. So it is on the increase. Have there been other drug epidemics in the past? Yes. This is the one that we're dealing with right now that is really taken over for this community and most of the state of Massachusetts.
I just want to add something to that. I see you, Amy.
No, go ahead.
So one of the things that we're facing in the city is that what's happened when she mentioned about the physicians prescribing these medications to individuals, where they're prescribing things to even teenagers and 12-year-olds who may have a sport injury, and within that sport injury, they prescribe a very high potent opiate to them for their pain. If parents are not aware of this, families are not aware of this, they're not educated, they're not receiving the proper education, the kids are now taking these medicines, these opiates, within their system, and it causes them to get hooked. And we're seeing a lot of trends in that area as well, which is unfortunate, and that's why we want to educate physicians. Another thing that we're seeing is that because of that, it leads to higher, more potent opiates, which leads to abuse of heroin. And that's what we see now in our city. We see a lot of heroin abuse. It's a high that is quick, it's stronger, and actually right now in the streets, the heroin is costing, $5, $6 just to purchase an opiate. I mean, a bag of heroin, and it's actually much cheaper than purchasing marijuana in the streets. So it's one of the things that the police is also facing, and they're dealing with that in their end. But we're seeing that spike in terms of the abuse of heroin, and we're seeing the overdoses even spike even more because of that. So that's something that I just wanted to add to that. I'm sorry, I saw your hand, but Amy, you had your hand up too.
Oh, sure.
You don't need a mic, right? You're pretty
Well, I'll try to speak loud for our friends here. So Eric, I think my question is more for you regarding some of... Thanks. So this is regarding following up on your idea around implementing after-school programming at local schools starting in January, is that correct? January of 2016. So can you just tell us a little bit more about the leadership structure needed for that sort of programming? Are these paid staff that are going to be like a point person at each school? And then talk to us about the actual volunteer needs so that we could potentially start planning for leadership at, in after-school programs. I think we have a lot of ideas around like potential program content that could help the kids, information about career opportunities and giving them opportunities for mentorship or job shadow, but I'm not clear about who's actually staffing and what are your needs around people to make that program happen.
So the structure will be each school, each site will be staffed by 4 staff. There'll be a site leader, one to oversee the site, and there'll be 3 staff reporting to that site leader. Out of those 4 staff, all 4 of them will be paid, and then the rest will be volunteer based. There will be a program director out of the manager's office. He's actually an intern for our office right now, and he's overseeing the development and implementation of this program with the Youth Opportunities Office as well. So there will be 4 staff per site, and then each staff will be paid, those 4. We've reached out to the schools to even potentially have some of the school teachers get involved, and maybe they want to get a part-time job, and this could be a great opportunity for them to work with us and be one of our site leaders or one of the staff members in their site or in their particular school they have selected. Now the school will be selected based, the superintendent, they will select the schools based on density of youth within the neighborhood, but also access to the facility. We want to make sure that access is, they don't have to walk through the whole building just to access the gym or other areas. We want to make sure that access into entry and exit, it's feasible for the program, and then also that the facility is big enough that it has a decent sized gym. There's, for example, let me throw a school out there like Clark Street School. It's a great school with a neighborhood that's very dense with Lincoln Village and Redwood Valley and whatnot. But that school, their gym facility per se, it's an all-purpose room. They use it for lunch. They use it for gym. But it's not as large. But yeah, we have a few couple, probably like a mile away, we have the Worcester Arts Magnet, which has a bigger gym, it has a bigger facility. So now we're being strategic in selecting Worcester Arts Magnet over Clark Street. So there's a lot of things that are played in selecting the schools, which then will help us in hiring the staff that will be adequate for those schools as well.
It kind of goes back to what you're saying about that you're wanting to educate physicians and nurses and pharmacists. And I'm totally aware of the fact that we do have a problem with drug abuse here in this area. However, how are we not generalizing that people who really don't have a drug abuse problem but still need those type of drugs in order to function? Are they being, because I've seen this a trend lately where doctors don't want to prescribe to people coming out of surgeries and they don't want to give them any medication because of, oh, well, we want to make sure that the state's not going to go in here and lose my license. How are we going to make sure that that's not happening, that they're not being punished for something that has absolutely nothing to do with them?
Thank you for bringing that up. I do get a lot of questions around that. We actually promote the use of a federally funded and certified training program, which is called Scope of Pain. And the training is done by people who are professionals in the field of family medicine and addiction medicine. And so I have been to trainings by different trainers who are Scope of Pain certified trainers, and they are really great about explaining all of the medications that you can use, what the different side effects and pros and cons are of each medication, and when it would be appropriate to prescribe each of those. And they get into those types of things and answering all of the detailed questions around that prescribers have, so that when they leave the training, they actually feel comfortable with, this is the type of thing that I should prescribe opiates for, and these are the questions I should ask people to see if they would be more likely to abuse them, or they've had a drug problem in the past, and then these are the types of things that I should prescribe these other types of pain medications for. And so they really go into all of that, and I think improve actually the access to opioids for those who truly need them for their medical condition, because they take away the questions that a lot of prescribers have, and they just don't feel comfortable prescribing any at all because they don't know what to do. So this training program is really fantastic at getting at all of the issues that you might encounter if you're a prescriber in an office dealing with a patient, and how you should make the decision whether to use opioids or not for that patient.
Is it voluntarily?
Yeah, we offer the training on a regular basis, working with this group that provides it. We co-sponsor the training with them, and then anyone is welcome to sign up for it. And sometimes we've done it specifically at certain medical institutions so that their staff has greater access to the training.